everybody. I'm Dr. Chinyere A. Ugoji, MD, MBA, in the Electronic Residency Application Service 2015 with updated licensing documentation, currently in clinical practice and graduate medical education, a master's in public health, social and behavioral sciences, um, with Capella University, Minneapolis, Minnesota, and a public health project on sexual violence, domestic violence as a public health concern, the American Mock Interview 2015, and the White House internship application. Um, Welcoming you to Dr. Chiquito Mentoring Iridescence Educational Collaborative Global Ustream YouTube show, a Reach Higher and Let's Move initiative of the First Lady of the United States of America, First Lady Michelle Obama. Today, the 13th of January 2015, it's approximately 7:15 a.m. Central Time, and I would like to share this quote with you. At each and every juncture of our history, somebody has been audacious enough to say, we could do better, and most often than not, it's been young people who have done it. President Barack Obama, February 2nd, 2007. This program will mentor and cultivate young leaders of today and tomorrow, and I am proud that they will have this opportunity to serve. I look forward to working with those who are selected to participate, and I want to commend all who apply for their desire to help through public service to forge a brighter future for our country. President Barack Obama on the White House internship, May 22nd, 2009. Education is the key to success for so many young kids, And my goal specifically is to reach out directly to young people and encourage them to take charge of their futures and complete an education beyond high school. First Lady Michelle Obama, January 16, 2014. Education is indispensable to the success of every individual and is the motivating factor behind my graduate medical education curriculum review. An interest in the Reach Higher initiative by the First Lady Michelle Obama, inspired by this quote by the First Lady Michelle Obama, and a determination to focus on education. Dr. Chinyere A. Ugoji, MD, MBA, October 25, 2014. I wish you good luck in your future endeavors. An excerpt from a letter from Dr. Janet Albers, MD, Program Director, Emeritus, Southern Illinois University Family Medicine Residency Program, Springfield, Illinois. Dr. Chinyere A. Ugoji was noted to be kind and personable. An excerpt from a letter of recommendation from Dr. Kimberly Baker Jinor, MD, Program Director, Emeritus, Henry Ford Internal Medicine Residency Program, Detroit, Michigan. Dr. Chinyere A. Ugoji completed a didactic month. An excerpt from a letter of recommendation from Dr. Sean Drake, MD, Program Director, Henry Ford Internal Medicine Residency Program, Detroit, Michigan. I also have excerpts from other graduate medical educators and also other documentation, including a medical school performance evaluation or dean's letter, a medical school transcript, letters of recommendation, photograph, ECFMG status report, USMLE transcripts, personal statements for internal medicine, family medicine, psychiatry, and pediatrics. So today, we are going to be talking about various interesting topics on Dr. Chiquito Mentoring Iridescence Global Educational Collaborative Ustream YouTube show, a Reach Higher and Let's Move initiative of the First Lady of the United States of America, First Lady Michelle Obama. We're going to talk about a case study of cerebral palsy, and then we'll talk about graduate medical education curriculum review, and we'll talk about hospital admission orders, and then we'll talk about graduate medical education collaboration. I'm going to be discussing my work on a graduate medical education program, Memorial Health Family Medicine Residency Program. Um, yeah, I'm Savannah Georgia with information appropriately cited from the website, and also I'm from the website, and also I'll talk about healthcare news, and also what about news in general, and also healthcare news, and then we'll talk about healthcare in Spanish. So first of all, we'll talk about we'll do the mini mental status um, the, the modified St. Louis University mental status examination by Dr. Chiquito Manfred Iridescent's educational global collaborative Ustream YouTube show. This is it's known for for this to be conducted in graduate medical education as a fun activity, and also to be able to make sure that you're up to par to in graduate medical education. So we're just gonna do that really quick. Is a fun activity. So um, the first section is the name. So just indicate your name. Mine is Dr. Chinyere A. Ugoji, MD, MBA. Your age, mine is 32. Is the patient allowed? For me, that would be a yes. Level of education, for me, that's graduate school. What day of the week is it? Today is a Tuesday. What is the year? This is 2015. What state are we in? Depends on where you are. We have offices globally. Yeah, in Washington D.C., in Dallas, Texas, and also in Illinois. Then please remember these five objects. I'll ask you what they are later. An apple, a pen, a tie, house, car. Then number five is you have $100 and you go to the store and buy a dozen apples for $3 and a tricycle for $20. How much did you spend? Well, the answer to that is 20 plus 3, which is 23. And how much do you have left? That would be 77. Then number 6 is please name as many animals as you can in 1 minute. So I have a list of animals. An ant, ostrich, elephant, iguana, buffalo, cat, cattle, caterpillar, butterfly, chimpanzee, chicken. That's just a brief overview of some of some animals that you can list. And the scoring system is 0 to 4 is 4 animals is the score of 0, and 5 to 9 animals is the score of 1, and 10 to 14 animals is the score of 2, and 15 plus animals is the score of 3. Then what were the 5 objects I asked you to remember? And the objects were an apple, a pen, a tie, a house, and a car. The next section is I'm going to give you a series of numbers, and I would like you to give them to me backwards. For example, if I say 42, you would say 24. So the first one is 87, which would be 78. 649, which would be 946. 8537, that would be 7358. Then the next one is an activity. On the next 3 is activities. To put in the hour markers and the time in the clock face at 10 minutes to 11 o'clock, and then put an X in the triangle, and also deciding which of the above figures is largest. And then the next one is I'm going to tell you a story. Please listen carefully, because afterwards I'm going to ask you some questions about it. And it's a story about Jack and Jill. We have talked about it before. And the questions are: what was the female's name? What work did she do? When did she go back to work? And what state did she live in? So the scoring system is listed on the mental status examination. I just bring this up because it's very important for us to be aware that this could be conducted anytime during your education, and also it's designed to be able to aid you in successful completion of graduate medical education. So with that, we'll go to the case study for today, which is cerebral palsy, and I will just do a brief overview, a brief exposition. For those who have been following our series, we have been able to work on this together and talk about and be able to publish it on WordPress. We are gonna um, um, work some more on it. We have had some technical glitches, unfortunately, but that hasn't, prevented us from being able to learn about various case studies. And we're still gonna try and see if we can be able to continue this exposition on these various case studies. So, what is cerebral palsy? That answers the question. What's the definition of cerebral palsy? Well, this is a group of disorders of the development of movements and posture causing activity limitations that are attributed to non-progressive disturbances that occurred in the developing fetal or infant brain with the motor disorders of cerebral palsy, which are often accompanied by disturbances of sensation, cognition, communication, perception, and or behavior, and or a seizure disorder. Now we'll go to the next section, which is how common is it? What is the epidemiology? Well, in developed countries, the overall estimated prevalence of cerebral palsy is 2 to 2.5 cases per 1,000 live births. Well, it's actually higher in preterm and also in very preterm infants. In the developing world, the prevalence of cerebral palsy is estimated to be 1.5 to 5.6 cases per 1,000 live births. So what are the risk factors? This answers the question, what are the risk factors of cerebral palsy? Well, maternal, prenatal, gestational risk factors, long menstrual cycle, previous pregnancy loss, previous loss of newborn, maternal mental retardation, maternal thyroid disorder, especially iodine deficiency, maternal seizure disorder, history of delivering a child weighing less than 2,000 grams, history of delivering a child with a motor deficit, mental retardation, and or sensory deficit. Polyhydramnios is another risk factor. So that's just to mention a few of the risk factors. And then going to the next section, which is what are the causes? Well, spastic. There are various kinds of cerebral palsy, and there's spastic hemiplegic, which can be caused by structural brain abnormalities, including hemibrain atrophy and post-hemorrhagic porocephaly. And also in premature infants, this could also be from asymmetric periventricular leukomalacia. For the spastic diplegic type, in premature infants, it can result from parenchymal intraventricular hemorrhage or periventricular leukomalacia. And also in term infants, no risk factors may be identifiable, so it could just be idiopathic due to no cause at all. And then in spastic quadriplegic, the causes are also listed. A different type of it is the dyskinetic or extra pyramidal type of cerebral palsy. Now we talk about the differential diagnosis. What else do you think about when somebody presents with cerebral palsy? Well, it could be inherited metabolic disorders. It could be metabolic myopathies. It could be metabolic neuropathy. It could be movement disorders in individuals with developmental disabilities. It could be traumatic peripheral nerve lesions, tumors of the conus and cauda equina, vascular malformations of the spinal cord. Then we'll go to the next session, which is the symptoms. What symptoms do you expect? Well, the patient may have mental retardation. The patient may have ophthalmologic and hearing impairments. They could have speech and language disorders. They could have oromotor dysfunction. They could have a history of gross motor developmental delay in the first year of life. They could have early hypotonia for the first 6 months to 1 year of life, followed by spasticity. So these are just some of the symptoms that you could encounter in a patient with cerebral palsy. And they also have motor disturbances, which are described in